Hi, welcome to Healthy Living. I'm Amy Bouton, Director of Communication and Marketing for St. Tammany Health System. So today I brought two special guests with me from the health system and from the St. Tammany Health Foundation to talk about World Autism Acceptance Month, but also to talk about an initiative that's happening and has been happening at St. Tammany Health System, and it's ongoing, to provide resources, education, and tools to parents and families of autistic children. So my first guest today is Sunny McDaniel. Sunny McDaniel is on the Board of Trustees for the St. Tammany Health Foundation. So welcome, Sunny.
Thank you. Thank you for having me.
Yeah, we're excited that you're here. We want to talk about our topic, right? World Autism Acceptance Month. But first I want you to tell people a little bit about you and your connection to the foundation.
So I started with the foundation 3 years ago. And when I joined the foundation, I knew my role was going to be starting the Autism Initiative at St. Tammany Health Systems. And there is a little bit background to that. I have 3 beautiful boys I'm very, very proud of, and a set of twins that are 11 and a 4-year-old. And one of my twins is autistic, and I knew very young, when he was very young, that he was. And so I knew in order to be able to advocate for him, not just personally but professionally, I needed to get more training and education. And so I enrolled into a graduate program at the University of North Dakota just in autism spectrum disorders. And that has helped advocate a lot for him, as well as my patients. And so what's happened with that is once we learned about autism as a family and we're growing, we realized that there's some missing links in the community. And one of those is in the healthcare system. And so when we started this autism initiative, what I've learned through my professional role in growing with my son, but also personal role, we've able to take it and implement it in other areas.
Okay, yeah, and this initiative, once we start talking about it, people's eyes will be open to how special
Sure.
it is, because it is amazing. And I tell people this all the time. I've told you this many times. It's the truth, what I'm saying. The first time I met you, I was blown away. Like within 15 minutes, I was like, okay, I kind of understand what
Yes.
autism is now.
Yeah.
You know, so I want you to share that perspective, and if you remember it, but I think you say it a lot to people because you want people to understand what autism is and
Yes.
how, you know, your child is a child who he needs a little bit of help, but he's just like every other child. So tell us
Correct.
about that.
So autism is a spectrum disorder, and it affects 1 in 36 children. But we need to make a note that a lot of times when we talk about autism, we're just talking about the pediatric population, and that's not the case. I just work in peds, so I tend this habit to talk about children. But the same philosophy goes into the adult world. So autism is a spectrum disorder. So Dr. Stephen Shore actually talks about this. He says if you know one child on the spectrum, you know one autistic kid. And it means that each of the core symptoms that make autism is unique to that individual only, okay? So what one autistic child might display as symptoms, a next one will look totally different. Mm-hmm. So what is it? Autism is a medical diagnosis, and that's important to point out because I'll come back to that in just a minute. But an autistic person will have challenges in 3 core areas. That is social communication, and that can be verbal or nonverbal. Mm-hmm. So a lot of times when you think about when we talk, a lot of times we speak, our message comes nonverbally. So I can say, oh, I really love that cake, and roll my eyes. We both know I didn't really like that cake.
Right.
I can be sad and still be happy. I can cry and still laugh, right? Mm-hmm. And so I watched this Stanford professor one time give a lecture, and it was very eye-opening, and it was about imitation wars. Have you ever seen that movie?
No.
So it's about Alan Turing, and Alan Turing was basically the father of computer science, and he was also a crypto analyst. And in this movie there is a scene, he's also known to be autistic, and in this scene he is basically he's with a government agency, and he's working away, and they're on this top, secret mission because they're trying to intercept the messages going over for our allies, right, to know where they're going to strike next. Mm-hmm. So in this scene, he's working away, and his buddies come on and say, "Alan, we're going to lunch." He doesn't respond. "Alan, we're going to lunch." Well, Mr. Turing doesn't respond at all. He keeps working. And they're like, "Alan, aren't you hungry?" And he's like, "Yes, I'd like a sandwich, please." Mm-hmm. And That was a perfect example, and that Stanford professor actually showed me that when I was listening to his lecture, because the invitation was actually this, right?
Yeah.
But he didn't respond until you asked him a question. So, Alan, we're going to lunch, doesn't require a statement. This was the invitation. So when you think that's kind of an example of the nonverbal component, all right? Eye contact and body language, I face you, I make eye contact. It's a cultural thing, but in our culture it says, I'm paying attention to you. So a lot of times people mistake that if I'm looking over to the side, I'm not facing you, and those things that I must not be paying attention at all, or I'm in my own world.
Yeah.
That is not the case. It's a sensory input of it. So the third core symptom is the presence of restrictive, repetitive behaviors, interests, or activities. And that's where you'll see, like, sometimes you'll get rigid thinking, you'll get struggles with transitions or flexibility, and the sensory components. And so when you look at that, it's kind of, I always give the example of driving down the road. You're driving down the road, you get lost. What's the first thing you do? You're going to turn down that radio.
Right.
The radio has nothing to do with you being lost. What you're doing is you're turning down that radio to decrease sensory input so I can focus.
You're tuning out.
Correct. Sometimes it's hard for individuals on the spectrum to be able to turn down that radio. So you can see that they just get overwhelmed.
Yeah.
And so when you're in society and you're working through society, and we've got this social rule book that doesn't exist, but everybody knows about, the rules change. And so sometimes autistic individuals struggle with that, where other people pick that up intuitively, if that makes sense.
Yes.
So when you're teaching a child or an individual, what you're doing is you need to teach them intellectually about the social rule book that changes based on the scenario. So if you think about it in that sense, it helps you kind of understand autism a little bit better.
Right. And so to your point about teaching them, teaching everyone about their environment. So what you decided to do is fill the gap of what was missing.
Correct.
As best as you could for parents in the healthcare realm. And part of that is St. Tammany Health System facilities, many of them are certified autism centers. Yes. And that doesn't mean that we are going to diagnose your child with autism.
Correct.
But we're going to define that in a minute. But you also offer resources and tools for parents to utilize before their child ever steps into one of our facilities. And that is important because of the sensory education.
Correct. So let's remember how I was just talking about how autism is a medical diagnosis.
Yes.
The medical community is not trained in autism. So what that means is that when I have a child that comes in that is maybe on the spectrum, we are more the screening process, okay?
Yeah.
And then we refer out for diagnostic evaluation, and then we refer out to the therapies, whether that's speech, OT, or the gold standard ABA. And so what I'm doing is with the St. Tammany Autism Initiative, I'm taking my medical provider hat, and then I'm also putting on my therapy hats, where they utilize tools to increase communication while decreasing anxiety. And so we use things like an AAC device, our visual supports, which is our stories, which is real life pictures. Of an example would be when someone walks into our doors from the waiting room to the nurse bringing them back, to the vital signs, to the physical exam, to when they leave and go to the parking lot. It gives them step by step, right? And so then we also have our video models, where it gives you a live version of that so they can hear the sounds. The best example I have of that one, which is probably one of my favorite ones, is one at the Bone and Joint Clinic, when you have a child that has a cast and that cast is getting removed, and they remove it with this saw, and that saw looks something dangerous, right? It looks like something out of the garage, but it's not sharp. So what we do is we show the video, we concentrate on the sounds that they'll see, or hear, what they'll see there, and then what things we can do to decrease that anxiety. And then on the other side is we have the clinical tools. So if I have a nonverbal child, I can communicate via pictures, or we call it picture exchange system, somewhere along that line.
Right.
And we create it that is individualized to that clinic, so unique to that clinic.
And that's part of the certification. So the certification, let's delve just a little bit into that. What that does, and to correct me, you can correct me if I'm wrong, but from my understanding, is the certification has educated our clinical staff on how to interact with autistic children and adults.
Correct.
If you're treating adults. Correct.
So right now we have our CAC, so that's a Certified Autism Center.
Right.
And who gives that to us is, it's called the IBCCES, and that's a big, long, it's a mouthful, but it's the International Credentialing Continuing Education Standards, and it is an international certifying body. And what that means is, in order to get this designation, 80% of patient-facing staff has to be trained, and that training or that certification is every 2 years. And so what it does is, again, we are not, medical community is not trained in autism, but what it does is it gives them the introduction tools to be able to help that child come through.
Right.
And so I always think about, there's always two kids I think about from the top that I see in clinic. And there was one child that was banging his head, right? Just banging his head. And my first question is that something new to the parent usually? And if it's not, it still means I need to provide medical clearance for the reason why he's banging his head. So any person that's nonverbal will communicate via behavior. So the thing about it is how do I approach an exam, or how do I approach this child where he trusts me enough and feels safe enough, communicating, but he's nonverbal, and then do an exam on him where I have to use, my otoscope or an exam to decrease sensory input. And the best thing is to prepare him. So maybe he's banging his head because his ear hurts, and I give him medicine, and now the banging of the head goes away. So it's very important that we understand what autism is and the sensory components. And then when we go into the medical world, when you're coming into St. Tammany, we are initiating those steps to where we can give quality care for the whole person in that scenario.
So I want to just tell everyone right now that when you go to our website, sttammany.health, you can search autism, and the autism page will come up with these resources and information and videos on it. And we have some other things that we do, but I'm going to save that for our next guest in the clinics. So last topic that we're going to touch, because we just have a couple of minutes left. We talked about this. We've talked about this a lot. You and I have talked about it a lot, and our team has worked with your team, and it's been great. And one of the things we discovered by accident last time we were talking is that, really this is innovation. It's not a robot, right? It's not a groundbreaking surgery, but it is an innovative model. It is. That is really the first of its kind in the country.
It really is. So we will even get emails, or our certifying body will reach out to us and, what are y'all doing for this? What are you doing for that? Because at the end of the day, I can get a certification. I can have a stamp on the door, a sign on the door that says we're this. But if we're not implementing it, it doesn't mean anything. And a lot of times we have the directions, but we don't know how to do it. So you think about it, you're putting together a toy, at Christmas time, right? And you're reading the instructions. Well, half the time I'm like, I wish I can just Google it and see a video of that, and it'll give me step by step. So sometimes the directions is not enough. So what we're doing is I'm taking the different hats from different disciplines and learning from others as well, and going, how do I make this better? And how can I show others how to make it better? So when patients do come in, they're not so scared. We also know that from a pediatric world, when they're transitioning into the adult, they're not going and seeking health care. They're stopping. That's not good, right? So what I'm trying to do is make it to where they feel safe, they feel heard, and they know that we're not going to put them in this box and assume what they can or can't do, or take their voice away, even if they're nonverbal, if you will. So I'm very proud of that, and it's I think it's growing, and I think we got some good things to come as well.
Well, I think so too.
Yeah.
And it's been wonderful to watch it evolve.
Yeah.
And so well, thank you for being here with us. You're a very busy woman with lots of energy that I wish I could borrow, but I can't. So, but thank you for coming, and thank you for sharing with us your story and your why, and talk about this groundbreaking initiative.
Thank you so much. I appreciate it.
So we're going to be right back with our next guest, so stay tuned.